Good evening. Welcome to our month-long e-campaign on breast cancer awareness brought to you by IHW Council and Novartis India. This is the second edition of the Breast Cancer Action Month, where we bring together all stakeholders, be it policymakers, experts, oncologists, social workers, influencers, and breast cancer warriors who have successfully overcome breast cancer on this very platform to create awareness about the disease and to motivate everyone to take proactive action to reduce its risk. We believe that even if one life is saved, because people are talking about breast cancer, the Breast Cancer Action Month will be a success. October is observed the world over as Breast Cancer Awareness Month, and we dedicate our efforts to the brave ladies and men who are fighting this disease. Let's do a recap of all the ground that we covered in our campaign last year.
Breast cancer is the number one type of cancer in women today.
मुझे आज ब्रेस्ट कैंसर एक्शन डे से उम्मीद है कि जागरूकता और उपायों के बारे में लोगों को बताकर हम देश में ज़्यादा लोगों के बीच कैंसर होने से रोक सकते हैं.
I'm confident that the contribution of the Integrated Health and Wellbeing Council will certainly help in checking and treating cancer.
That this is preventable, provided we feel ourselves on a daily basis. We love our bodies, we value them and take care of them.
Awareness around cancer, awareness around women health, awareness about around all the artificial things that we engage in, and vanity has its own impact on our health, and I think it's time to turn the tables on the other side.
In order to defeat breast cancer, it really takes a village. In other words, it's take a holistic approach, not a silo approach.
The problem is really at two levels. One is, like I said, with the media centering a lot of communication around what is significant in that month. And the second is, as a society itself, we just don't want to mention the word breast.
We have to create a complete ecosystem which can really help early detection, early treatment, and help patients live a longer and healthier life.
Make sure that you put the patient at the absolute center of any solution that you design.
We have to educate them to do their self-examination first and to encourage the women to go for tests, which is very, very important.
I see role for each and every one to come together and, make this Indian healthcare system a very robust one.
Nothing stronger, this applies to than cancer prevention as well as early detection.
Over the last 1 week, We have heard oncologists, social workers, influencers, policymakers, and cancer warriors talk about breast cancer, and everyone agrees that early diagnosis is the key to fighting this disease successfully. We have also heard from cancer warriors and support groups that along with the latest medical advancements, patients need love, support, and empathy in their battle against this disease. Here are some of the highlights of what our experts discussed on the show in this year's Breast Cancer Action Month.
Welcome to the second Breast Cancer Action Month, a mega month-long movement to strengthen awareness about breast cancer and encourage action against this fast-growing public health menace.
The bottom line is the lady should be made breast aware.
Number one, clinical examination. Number two, an ultrasound if a lady is young lady as Neha, or a mammogram if they're above 40, and a guided core biopsy. Triple assessment, 99.5% will give two answers. It is not a cancer or it is a cancer.
We are going to get better. The diagnosis is going to be early, and hopefully patients, individuals who are unfortunate to get the cancer will be fortunate because they will get access to better and better treatments.
Not for diagnosis or of cancer, but we would like the person to be familiar with a normal breast. The individual should be familiar with a normal breast.
Understanding the complexity of the disease, developing innovative therapies that changes the curve of patient survival.
It is really important for a clinician to understand the tumor makeup to deliver, to offer the right treatment for the right patient.
The type of surgery also influences the survivorship. If patient has undergone a conservative surgery, means breast has been conserved, these patients have better life compared to the patients whom the whole breast has been removed.
You should live each day as it comes, and then you aspire to inspire before you expire.
We've tried a no-touch screening process, which is more or less like your radio frequency one which you have at the airport. Just have a no-touch screening process.
Cancer management, especially for breast cancer, I think women should not be worried about their diagnosis of cancer. In fact, they should think it positively. Yes, they're diagnosed at an earlier stage. It's very good.
Treat later, it's worse for you, then you fund screening much earlier.
Self-examination, screening test, early detection, importance of early detection. It can be imparted in the early school age, and these girls will motivate their mothers and they will motivate their in-laws also for that.
It is possible to cure breast cancer, and they can be as normal as possible in their life.
Now, we've had breast cancer warriors who have joined us this month on our show. Many of them have found their calling to help others by either being part of counseling or support groups to help other breast cancer patients, or help in creating awareness about breast health for early diagnosis of breast cancer. But these efforts are exemplary. Using the same adage that it takes a village to raise a child, it takes an entire ecosystem to stem breast cancer. In our show today, we will try to understand how leaders in different parts of the society, be it a policymaker, or be it an employer, or be it a healthcare center, how all of them view breast cancer and its implication on half the population of our country. Are leaders seized of the magnanimity of the situation, given the projections of cancer cases likely in the decades ahead? Are they investing enough to be able to cater to the healthcare needs that may arise in the future? Have we calculated the probable loss in productivity if a significant part of the workforce is impacted by breast cancer, which could be debilitating for a few months for those who are recovering? So these are some of the issues that we will be discussing on our show today. Please welcome our panelists. We're happy to have with us Dr. A.K. Rathi, Director, Professor and Head of Department of Radiotherapy, Maulana Azad Medical College, New Delhi. Please welcome Dr. Ajay Bapna, Director and Head of Department, Medical Oncology, BMCHRC, Jaipur. We're happy to have with us Dr. Blossom Kochhar, Founder and Chairperson, Blossom Kochhar Group of Companies, Ms. Urvashi Prasad, Director DMEO, Niti Aayog, Ms. Karina NG, Head of Marketing and Commercial Excellence, Asia Pacific Novartis, and Ms. Jyostna Govil, Chairman, Indian Cancer Society, New Delhi. A warm welcome to all of you on our show. Thank you so much for taking the time to join us. Jyostna ma'am, let me begin with you. We have spoken a lot about breast health, breast cancer, early diagnosis during the course of this month. But breast cancer is largely seen as a disease that affects the women, though it does impact men also. And in our country, it seems that women's health is not a priority for either the family or even the government. How do you see this? Do you think that now things are changing?
Anisha, you gave us 3 key words in the title of this program, and they were women, health, and cancer. So I thought I should work on, where our issues really are. Now, you wouldn't believe that there could be any other definition of a woman other than that she's a female adult. But recently, various magazines, The Lancet among them, have been talking of women as people with vaginas, which frankly I found offensive. They've had to apologize for that. But the fact of the matter is that women are still an enigma. Somewhere there is some confusion between the woman talking too much on the one hand and not talking enough on the other, not coming forward early enough to talk about their problems. But when you look at what is happening with women in most parts of the world, and India, of course, women are not taken seriously when they first approach with a vague symptom, a small lump, maybe the size of a pea in the breast. And they're told, come on, that's nothing, just carry on with your life, you'll be fine. When they then come back with the lump the size of a lemon, they're told, why didn't you come early? What were you doing all this while? So where does the woman go? So although we keep talking that women are coming in late stages, we have to see whether the environment, the medical, social environment encourages women to come in at the correct time. Too early is much better than too late. So instead of dismissing women as neurotic, as fanciful, as too engrossed with themselves, I think it impinges on all of us, the doctors, the screening agents, everyone, to look at the physical symptoms first and then start giving them labels of neurosis or any other thing. Yeah. Of course, everyone has spoken about a woman's role in the family. She cannot just get up and go. If a man is diagnosed, he can just leave and go to a hospital, go to a treatment center 800 miles away if necessary. A woman can't do that. She has to make arrangements for her family, for her children, for her in-laws, for everyone else before she leaves. So many times in major hospitals in Delhi, we find women coming with small children. They're told, leave the children outside. Where? Where is the place where a woman can actually do all that? So when we talk about women and health and cancer, we really need to think, are we making it possible? Are we making it easier for women to actually come forward at the correct time and get the right treatment?
Right. Jyostna, you've raised very, very important points. Some things that we have not discussed so far. On our show, I don't think any of the ladies or who are cancer warriors were labeled as being neurotic because they wanted to get investigated. We had one very young cancer warrior who had to get 3 biopsies before her diagnosis was confirmed. But perhaps this does come from the general stereotype that women are obsessive about things, and they're really taking it too far. Urvashi ma'am is with us on this call as well. Perhaps women would feel more safe, secure, and forthright about talking about their health, about coming up with something that they feel is amiss, if they feel that they're going to be heard without judgment. Now, this could come if we have a good healthcare system that is proactive towards women's health. Now, we've seen recent government initiatives in maternal health and infant nutrition, which are very laudable. But it is believed that women's health is really not a priority for policymakers. Health wasn't a priority until COVID arrived. So when we say that, what is the government's focus on the women's health? Is it there? Are they doing something beyond just maternal health?
Yeah, so yes, you're right, Anisha. Actually, getting focus on health itself becomes quite difficult. And then within that, getting focus on women's health, that has added layers of complexity, because government also, ultimately it's in some ways, many ways, reflection of, what's also going on in society at a broader level. So it's not completely, detached or divorced from that. So I think that, from the government's point of view, I think the priorities are very clear. I think the pandemic has now created some immediate and additional challenges, because we possibly have a lot of women who either had to delay their treatments or miss them or delay their surgeries, and that can seem a little invisible and silent. Societal and financial for the government is there, but I think at a broader level it is about putting in place a system which is data backed. I think that is something we really need to do a lot more. That is something that I advocate for a lot more, because even within India the statistics are not the same across. There are places where we might be having slightly higher screening rates, in other places we have much lower. Incidence rates also vary tremendously. So are we really actually analyzing all that on a regular basis and then designing our interventions in a much more targeted way? I think that is something from the policy side we need to move towards. But also equally, providing those mechanisms for diagnosis, for treatment, whether it's through Ayushman Bharat or whether it's through the health and wellness centers, we need to put in place those enabling mechanisms, as governments, because I think a lot of the other issues, whether you call it awareness, whether you call it, are we actually making it easier for women to do this or not, require a much broader partnership. It's not just the government, but we would require the medical fraternity, the private sectors, citizens themselves, civil society. So I think that is really a big piece that we do need to tackle and is critical, as has been highlighted. But I think as the government, there's a lot of other things we can do to put in place that enabling ecosystem, which we need to focus on. I wouldn't say that, there's been no progress, because that would sound terribly pessimistic. I think we've made some progress, but I think we have a very, 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 very long way to go. So I think these are the kinds of directions that, we are hoping, at least we are advocating in the work we are doing, and we are hoping that, the government will take some of these up on priority.
Okay, so we need data, but for data, we need a lot more women to come up and talk about what they're going through. And if they suspect something, once they go to a healthcare facility, we'll collect the data also. Now, everything is digitally driven, and that should also help with policy making. Dr. Blossom Kochhar, you work with women on all kinds of levels, on beauty, on, self-image, everything. Now, Jyostna ma'am said that, women have been described as human being with vagina, and that's not very kind. And she has pointed out something that, women are stereotyped as being obsessive about their looks, about, what they are and, what they feel. How do you see the woman's place in the society? So far, it has not been on an equal pedestal with men, and that may not be a problem only in India. But when it comes to the healthcare, are we at an equal footing? Dr. Kochhar, I'll request you to please unmute yourself.
Yes. Hi, thank you. Yeah, so let's talk about women and, when they come on a social this thing. Now, till now, of course, women, and one thing I must say, women all over, whether anywhere, they put their health priority as last. You know that they will first, and especially in India, they will first look after their husbands and their children and their in-laws and everything else. And then you will find them coming through. In fact, when it comes to even eating food, I have found so often everybody else will be fed and then we'll say, aren't you eating? And then they will go and eat. So they feel their health is the least. And also, it used to be in families. Now I think it is changing a lot, but it used to be in families that, of course, the woman was always there and always bright and always there to help. So the health didn't matter at all. And what I really feel that, that we all should do is that we have to tell the woman, and this is what we have been doing and I have been doing all over when I go, that you are a very, very important person in your family. And if you are healthy, if you are happy, you will find the whole family will be healthy and happy. So we have to put it into their heads that they have to look after themselves. They have to eat nutritious food. They have to see that they look after themselves. They have to, like when it comes to cancer and breast cancer, we teach them how to give themselves a massage and to, self-examination if they don't have the time, so that if they detect any lump, they can really go through and get themselves treated. This is very important, that we train a woman and we tell a woman and we make them really look after themselves, because they are born to look after others. They are born to nurture others, and they always take everything last onto themselves. So this is what we have to do. We have to look after them. We have to tell them that they are very important. And I feel everybody should do that, right from government, social media, everywhere that we go, that women are very, very important. They are the most important, because if they are not happy, their family is not happy. If they are ill, the whole family is, upset and ill. So they have to look after themselves, and they don't just need to smile and feel that, everything is okay. This is the simple thing, that it is a very simple thing. And I think we all need to do that and go through with that.
Yes, let's hope simple things are easy to understand and as easy to implement as well. Yeah. Dr. Rathi, do you think, I honestly think that oncologists are very smart physician. And when a woman has reached an oncologist, there is no way that the oncologist will, shortchange her, question her ability to decide for herself at all. If she's reached an oncologist, something is definitely wrong. But do you think women get judged when they go to regular physicians? क्या हो गया? अभी तो बच्चा हुआ है, इतनी जल्दी क्या हुआ है? ये तो breast feeding का कुछ problem है. Does this stem from ignorance of these physicians of, something like this, a breast cancer issue that could come up? Or does it stem from judgment of how women react to their health?
See, Anisha, what happens is, most of these ladies, women, they go to their gynecologist for all their issues.
Yes.
So hardly ever they would approach a surgeon.
Obviously, you would go to the doctor you trust, but that doctor
listen to me. The first doctor for a woman is a gynecologist. So they actually go to the gynecologist, tell them their problems. Unfortunately, this gynecologist is trained for gynae, not trained for other things. She has a basic training, but then these people might ignore the problems. Though when you are breastfeeding a child, there can be a lumpish feeling, and a normal breast if palpated wrongly, will give a lump. If you do not know the exact method of palpating a breast, you will always feel lumps in the breast and you will land up doing unnecessary biopsies, unnecessary FNACs. And this creates a mistrust. कि डॉक्टर ने तो FNAC करा दी, वो तो उसमें कुछ निकला नहीं, पेशेंट ने कहा तभी डॉक्टर ने कहा, दोनों तरफ से ना, it is this way. So there is, and when it comes to oncologist, हमारे पास तो पेशेंट आता ही डायग्नोज करके. When you have a proof of malignancy, then the patient comes to us. Then so there is no, this is only a one-way thing. You come to us with a confirmation. We as oncologists do not entertain anybody who's got a doubt. This doubt goes to a surgeon, a general surgeon, or maybe an onco-surgeon, or maybe a general physician. And then when this is proved, then it comes to me or people like me. So then there is no going back. Then we have to plan the treatment. And these women are smart enough. A poorest of poor person. गरीब होना जाहिलता नहीं है, गरीब होना अज्ञानता नहीं है, ये बात माननी पड़ेगी हमें. सब लोग ज्ञानी हैं आजकल. I'll tell you example. मैं लोकनायक हॉस्पिटल में हूँ. एक दिन मैं घुस रहा था हॉस्पिटल में, एक बाबा जी बिल्कुल गांव वाले, typical attire of a गांव, and the lady also attired in a बिल्कुल गांव वाली. I belong to a village. So दोनों husband wife, they would be around 70 years. And he asked me a very local term, the breast is called chuchi in the villages. He said, Doctor Sahab, मेरे को ना इनकी चूची की जांच करानी है. मतलब this is the kind of awareness this is there in the society. So this is what we have created over the years. And I was thrilled. मैंने कहा अब लोगों को इतनी जागरूकता है. मतलब वो बंदा गांव से चल के लोकनायक तक आ गया और टकरा भी मुझसे ही गया, क्योंकि मैं oncologist हूँ. By fortune, then I guided him towards the right place. He got a FNAC biopsy and then ultimately we treated the lady. So that is what is all about. Okay. You're painting a very rosy picture, Dr. Rathi. If everybody is so aware, why are women coming in third and fourth stage cancer? Nearly 40-50% of the women in our country go in this stage. This is not a rosy picture. This is not a rosy picture. This is not. You said they're all aware. No. There is awareness. See, I started my career in oncology in 88. Over these 33 years, there is a change. Okay. आज से 33 साल पहले कुछ था, आज कुछ. So there has been a change in the awareness, change in the people coming to treatments. Unfortunately, during this COVID time, these patients could not get treatment. We were all afraid of COVID. Nobody was coming to hospitals. And when patients got treatment was withheld for whatever reason, they came in a very bad stage, and now we are handling these patients. So this is what has happened, but awareness is there. We need to increase it more, but it is there. We can't say that it's not there. And credit goes to media and the government both. Okay. Dr. Bapna, Dr. Rathi is saying that there is an improved awareness from 30 years ago to what it is now. And credit goes to media and government and NGOs who are working. Now, breast cancer is a screenable cancer. If there is awareness, is enough effort being made about screening and early diagnosis at health centers, at hospitals? Are we doing enough?
No, not at all. This is only in the papers, the screening procedure, because you need to provide the, the healthcare professionals at the grassroots level, at the periphery level, and you need to have then the paraphernalia to screen these patients. What do you require is a sophisticated mammogram machine, or at least a good sonography machine to screen or look at the breast. Where are those? They are not at all available beyond the district level.
So then what do we do, Dr. Bapna? If we keep waiting for the mammograms to reach, then we will never find a solution.
So the other solution for this is that we need to train the Asha workers and the local gynecologists and other NGOs to train at least the women about how a normal breast look like. I think if they are being trained for even this, we will achieve a lot. If they can understand between a normal breast and the abnormal breast, I think half of our problem can be solved. And later on, if they found any abnormality, then they can be referred to the district level. But first and foremost thing is the awareness about their own breast.
Jyostna ma'am, Dr. Bapna is saying that we need to have Asha workers mobilization so that the screening happens, because mammograms can't reach every village. We know that, but we can't say, let's wait for the mammograms to come. It'll be too late. So, we have to mobilize people to do self-breast examinations or CBEs, clinical breast examinations. In a previous show, we have a representative of Novartis telling us that in India, the policymakers have shown a lot of flexibility. A lot of Asha workers are doing this, though it may not be their primary brief. They are doing it in addition to what they are supposed to do. Now, Asha workers are making effort, NGOs are making effort, advocacy groups are making an effort. Is the medical system making an effort?
I'd like to say yes, but it's also no, because like Dr. Ajay said, there's a huge lack of resources or whatever. I don't count electronic machines as resources necessarily. I think that we need to have a proper integration between the medical fraternity and the social sector and the Asha workers or the ANMs and the nurses. I think too often they are discounted. Asha workers are very, very hardworking women. They are not valued enough. They are underpaid. They are overworked. And if we want them to start doing examination of breasts and cervix, then I think they need additional incentivization. I think they need respect. They need to be held up as an example of what can be done when they do their jobs properly. The same is true of the NGO workers. We go out to the boondocks, literally. We take one village at a time and we try to screen women. I mean, sometimes the state of the women who come is so pathetic that we just wonder, हम दवाई तो लिख के देंगे, लेकिन ये ले पाएंगे क्या? What about the cost of medication? I think all these things need to come together before we can talk of an integrated health system. I'm not talking only of cancer detection. I think we need to talk of breast health. We need to talk of cervical health. We need to talk about the healthy version of what is happening. I'll give you one small example. Endometriosis in women is very high. It's about 10% of women who have it. It's higher than what the rate of diabetes in this country. And yet, we talk diabetes, everyone knows sugar hai. But who has heard the word endometriosis?
Jyostna ma'am, that's a woman's issue. Why should it be on anybody's priority? It's not a life-threatening disease. Who cares?
It is. If neglected, it is. And Anisha, I think one thing that needs to be kept in mind by everybody, cancer is the only curable NCD. All the rest are what you manage. You can't cure them. So let's at least look at what we can cure and get there. Until I think about 30 years ago, there was no understanding of breast or cervical cancer. I've heard some of the policymakers on your program last year say, feel your breast every day. I mean, you'll really go mad if you were feeling your breast every day because you will think of something or the other. So I think the education levels is not merely at the poor woman in the villages. It is for the policymakers. It is for all of us. Until we, as educated or so-called educated people, don't understand the nuances of women's health, how do we convey it to the women themselves? Actually, they're much smarter than us many times.
And let me add to Madam Jyostna's whatever she has said, even how many people are aware at the grassroots level that the self-breast examination need to be done 7 days after the cessation of the menses.
Dr. Ajay, I can go back to a time when we used to, I've been in this area since 1984. So I've seen plenty of changes. We went gung-ho, really, woman to woman, teaching them breast self-examination. Then we get a doctor who comes to the thing and says, "ये screening क्या होता है? ये बेकार की चीज है. कोई चीज निकलती है तो हमारे पास भेज दो, हम ठीक कर लेंगे." Then what preventive health are we talking about? पहले तो doctors को दिखाएं.
बिल्कुल.
Preventive health is necessary. And
yes,
then
Jyostna ma'am, in our campaign last year, we had some knowledgeable people say, Asha worker will थोड़ा find out breast cancer है, वो तो doctor ही करेगा, वो थोड़ा
no actually
का इलाज ढूंढ लेंगी.
Tata Memorial Hospital, madam, did a very, very large study of, one of its kind in the world, where they trained the, ladies of equivalent to Asha worker in Mumbai, and they screened some 40-50,000 women, and they reported it, the significant decrease in the mortality by teaching the slum ladies.
I agree, Dr. Bapna, that, on the ground, you will find evidence that if women on ground are doing things, you will find evidence that it works. But people higher up think, ye kya hai? Wo bhi doctor thona hai. They are not going to find the disease. Again, their contribution is discounted. They are not incentivized, but they still deliver the goods. So, Urvashi ma'am, Dr. Bapna feels that, this mobilization at the grassroots level will help us in early detection of breast cancer. How much is being done towards this in training and incentivizing the Asha workers so that, they have a direct connect with women in the villages? How much work is being done in this respect? And is this going to be enough? At the hospital level, is enough being done for screening, for early detection?
I think she's left, Anisha.
No.
She's on the call, but
she's on the call.
She's on the call.
Okay.
Urvashi ma'am, if you can hear me, my question is about, the training of the Asha workers, because Dr. Bapna has mentioned that they could be an effective tool because they have a direct connect with the women in the interiors.
So I think this is
her bandwidth is, I think.
I'm here. Yeah.
Yes, I think. Urvashi ma'am, we're having a tough time.
Can you hear me, Anisha? I can hear you.
Yeah, please go ahead.
Can you hear me?
Yes, ma'am. Please go ahead.
Can you hear me now?
Yes.
Yes.
Okay. Yeah. Sorry, I'm in a very poor connection area, but so I think it's true not just for breast cancer, but I think a lot of the challenges that we face, we actually adopt what we tend to call an over medicalized or a hyper medicalized approach from the start. So we actually, public health has been hugely neglected, and I come from a public health background, so I'm all for using our health workers at all levels. Now the challenge there we face is that we already expect our Ashas, our ANMs, we expect them to do some Herculean tasks with very minimum compensation and incentivization. So what we are instead advocating that let's build up an entire cadre of such professionals, and that's what we are aiming to do through these health and wellness centers. Again, there's a big gap between policy guidelines and operationalization, and we have to fill that gap. But the intent is that you don't just have your Ashas, ANMs, but you actually have a cadre, whether you call them mid-level providers, whatever you might call them in terms of nomenclature, but you build up an entire public health cadre from the grassroots, growing right up to the higher levels of the health system, because public health has to go alongside our doctors, our specialists. They have a very critical role to play, and nobody can ever take that away. But there are many other tasks which a public health professional, a public health cadre is much better suited to develop. and to implement. And I think that is where our focus needs to shift. So we have actually done a lot of work on conceptualizing this. We are working with many state governments to try and roll it out. And hopefully once we have more of that cadre in place, then at least some of these issues, right? So even awareness, I think as the panelists are saying, that it's not just being aware of, what the disease is, but actually being aware of, much finer points. How often do you do this, breast self-exam? When do you do it? When do you actually approach a health provider? So, going into much more specific details rather than, just saying, okay, I'm aware of, what breast cancer is per se. Now, these are all things which a public health cadre can actually do quite effectively. And given our scale, given our size, given our complexities, we do need to move in that direction rather than only relying on our doctors and specialists for everything. So I think hopefully that is something that we will see more of a shift in the policy. We're certainly trying to work on that. Even screening, that's one last point I'll make on this, that even for screening, we're trying to see that, how do we have levels of screening, right? So exactly, you have the self-exams, you have the clinical breast exams, which lower skilled workers, as we might call them, they can also do. Then when do you escalate, to the next level, right? When do you say, okay, now a woman probably needs the ultrasound, she probably needs a mammogram. So we need to have these levels in place. It cannot be that for everything, people just land up at a hospital, which is really a lot of what happens today and has happened in the past. We need to build up these levels of care, and we're certainly trying to do that, but it's going to take, obviously, its own course. So
okay, but this is a good idea. No, not only will health be taken care of, we'll also have employment, and we'll have a on a one-on-one basis a solution for people in the interiors. And this is something which is perhaps going to be a great idea. Now, we've talked a lot about bottom of the pyramid, how on the grassroots we're going to get everybody involved, create awareness, create early screenings. What about the top of the pyramid? Karina is with us, and I want to understand from her, how important it is for having women in leadership positions, so that this is, on a top-down level, the message is reaching that this is important. So, Karina, how important is it for women to be in leadership roles in healthcare in order to ensure that segments of women's health are addressed and these real concerns come to the fore?
Anisha, maybe if you may allow me, before I answer your question, I want to add on to the previous point from the other panelists, because I think tackling this awareness to action needs all facets at the same time, right? I think at the beginning, you opened the call by saying it takes a village. And it really starts with the individual, to the woman herself, to understand the importance of doing these exams regularly, and to understand what is the impact of being diagnosed early versus at a later stage, so that all the other activities that we have in place can kick in, right? Because I think if the desire to do something is not there to begin with, even if the tests were available, even if the education systems or activities were there, it would not be received as well. So I think it really needs to happen at multiple layers. And I actually can speak about myself. So I work at Novartis Oncology. I work in an oncology company. I look at the breast cancer product data every single day. And I can tell you that the last time I did a screening was just this, I did it earlier this year. And the time before that was 5 years ago. And the only reason why I did a screening this year was because I attended this meeting last year, and it was about awareness to action. And I had a big wake-up call because I'm working in an oncology company. I know exactly the reasons why you should go for screening and why timely screening is important. And yet I've waited 5 years. And so it was for me that I took away from last year's meeting that after the meeting, I will go and schedule a screening. And so that was what happened. So I guess what I'm trying to say is it's very easy for a woman to lose sight of their health being the biggest priority because, either they have a full-time job, plus the family, plus lots of other priorities. And then at the end of the day, you're just too tired to think about anything else. So I think that's just one comment from my side is about, starting with the individual. How can we, make sure that the importance of screening is well understood by the women themselves. And then to add on to respond to your question, what do we need more women at companies, at leadership roles? And I think the answer is definitely. I think we need more women in every position that we have in a company like ours, because we bring different perspectives to look at the issues that the patients may be facing. And while we're talking about breast cancer, I will also talk about an experience that I had before when I was in the department selling hormone therapy. And at one point we noticed that the entire team were men. And it was because of that, we actually missed a lot of insights that as a mom, you would look at the problem very differently than an entire team of men. And so I think it's really important that to bring these different perspectives onto the table. And then recently when my son started to show some growth delays, and I started looking into growth hormone myself, I had a completely different perspective. And I come to realize things that we sometimes think are important as a pharma company are not important to the patients or the caregivers at all. So I think the more perspectives we can have in the company, the better we can provide a solution for the patients. So the answer is definitely yes, we need more women at every position in the organization.
I'd like to add one sentence, please, to what you just said, Karen. In the area of gene testing is another place where we need women. When a woman is tested for a BRCA gene and she's told that it's positive and that she needs to lose a remaining breast and possibly the ovaries, it would come better from another woman rather than a man.
Yes,
I'm not saying men are not sympathetic. They can be, but I don't think that a male doctor would put his arms around the patient and comfort her.
Yes, we had a male doctor telling us that genetic counseling is important, but it is just not what we find. How you tell the report is also very important, because you have to explain to them the implications and what it means for the future life. So that, of course, oncology is also something that is coming up. I want to come to Dr. Blossom Kochhar. Ma'am, you have said that, we have to put women at the center of our families. We have to give them respect. We have to treat them well. And we have to recognize their needs. Now, cancer is a debilitating disease. When you take treatment, you need time off. And, we need to create sensitivity among society towards the cancer patient. But should breast cancer be seen as a women's health issue, or should it be seen as a cancer care issue? Because we want them to get love and support, but should it be seen in a feminist light that this is a woman's health issue, so please be kind to her? Or should this be seen as part of cancer care? A man can have a cancer problem, he also needs empathy. A woman has cancer, she also needs empathy. How do you view this?
I think it's a cancer care problem. It should be taken as a cancer care, not just as a woman's problem, because it's the whole family has to come together. And if she has cancer, their whole care has to be given to this woman to get her through. And it is very holistic. It has to be with the mind. She has to have a mind that is, a mind also has to be no tension, no stress. She has to go through with her nutrition. She has to then, there is a whole holistic approach to the whole thing as cancer. And of course, the way she's definitely going to not feel good, because she'll have a problem with her hair. She's going to have a problem with her skin. And so the family definitely has to come together and rally around. And I have seen when a family comes together and rallies around the person who's got cancer, and you're talking of breast cancer or any cancer, I have found that that person makes it. You know, there is definitely, she is going to make it, because it is not just her own or just, it is a full family that has to come together, and they have to make her happy, because happiness and laughter is really, I mean, of course, the doctors are there to give you all the treatment and everything else, but you have to have this happiness and laughter. And I believe this one thing, just keep making them laugh, making them happy, making them believe that they can make it. And who can do it is the people around. So it is a family affair, and it is not just a woman's cancer affair. It is the whole thing. And I feel it's a society affair, and everything has to go together.
Right. Dr. Rathi, what do you think? Should breast cancer be seen as a women's health issue, or is it a cancer care issue? And how does the medical community look at it?
Family illness. The lady of the house has a problem. We have now nuclear families. You know, most of us have nuclear families, husband, wife, 2 children. Some may be school going, some may be college going. But it's a family illness. You know, it is not the woman only who is suffering. You know, I will give you an example again. I was in a hospital, you know, an old man with this lady used to come for her treatment. And, you know, incidentally, he also got diagnosed with a cancer. Now, they both would come to the hospital, get each of them treated, go back home. So this is, you know, when it happens in old age, when you are left alone, and it happens quite often times, you know, then it is the two of you have to manage. If my wife is, you know, like she was ill for some time, so I had to manage everything. So this is a family affair, not at all an individual's affair. When it becomes an individual affair, you always fail.
Yeah, that's
always fail. Take it from me. If you left it to the woman alone, she will never recover. She will never recover. If she has to recover, the whole family, the whole people around her will have to, you know, share the responsibilities. And, you know, her worry is not about her illness. Unki worry kya hai? Bachcho ko khana milega nahi milega, school time se gaye nahi gaye. So there are a lot of things going in her mind. So you have to be relaxed that bachche bhi school jayenge, unko khana bhi milega time se. You just don't worry. So that kind of assurance has to be given from the family. If that is there, definitely this lady is going to relax and take the treatment well. Otherwise, the treatment is interrupted, and an interrupted treatment is never successful. In oncology, the best treatment is the treatment which goes in line. You know, don't have breaks, don't have interruptions. So then you get the best results. So for best results, we need to get together. And the family has to, the society at large, society ka bhi role hai. Society to सिर्फ यही कहना बंद कर दे, you know, everybody who visits you is, अच्छा वहाँ पे वो वाला इलाज होता है, वहाँ पे वो वाला इलाज होता है. अब ये बड़ी समस्या है हमारी. हम इलाज कर रहे हैं, मगर उसको एडवाइजर्स इतने सारे हैं ना लेडी को, and those advisors simpler. वो जो इलाज हैं सारे, वो चूना चटनी वाले सब easy है. वो सब the patient gets diverted to those things, and many times we lose our patients to all these alternative therapies. I don't oppose alternative therapies, but they have to, they should discontinue our treatment for alternative therapies.
सबसे ऊपर तो डॉक्टर गूगल है.
But once you trust your doctor and you have one medicine, you should at least go the whole course. And you know, oncology teams, everybody has to motivate the patient and the family कि आप जो भी try कर रहे हो, this is one medicine, this science that you have to stick with, because if found early,
वो आपको बताएंगे ही नहीं. I'll tell you another example. There was a patient, you know, we were treating her. She had a side effect which I was not able to explain the drugs I was giving her. So generally उनसे पूछोगे तो बताएंगे नहीं, फिर प्यार से पूछा, अच्छा कुछ और दवाई ले रहे थे, जो उसने जो बताई थी वो ले रहे थे. Ultimately she came to her, she told us कि मैं वो वाली दवाई ले रही थी. You know, these
that was the side effect of that medicine.
Yeah, they add to the toxicity and they interrupt our treatment.
Yeah. So
Dr. Saab, just one more. What about the caregiver, the male caregiver? I think very often that poor man gets totally neglected.
He has the worry and the stress of the financial burden also, ma'am.
Absolutely. So I mean, everybody pushes him aside. I want to ask the doctors, please, थोड़ा सा प्यार वो male caregiver को भी दे दीजिए.
I think they need counseling. I really feel there should be a lot of counseling in these cancer places, you know, because
Absolutely.
they definitely need counseling. Everybody need counseling, not just the patient, but the caregivers, the children, they all need counseling. And I'm telling you, if you give them that counseling and the correct treatment, there is going to be a fantastic difference, really. Already we are seeing a lot of difference, but we can see much bigger.
Much more.
Right. Dr. Bapna,
Yes.
to your mind, what are the areas that need attention in breast care diagnosis and treatment from the healthcare perspective?
I think first and foremost, by any means, we need to create awareness by putting this issue in the syllabus of at least 11th and 12th class, because these are the group of the students who can at least start guiding their own family members who are females. And secondly, I think the breast cancer subject as it is should be put in the gynecological curriculum, because gynecologists are really allergic for the clinical breast examination, because they are so very overworked. And
yes, but Dr. Bapna, then you should have like like Urvashi ma'am is also saying, अब सब कुछ थोड़ा डॉक्टर करेंगे. मतलब
no, I mean I think in their lifetime every woman at least once contacts the gynecologist. So it will be a very good idea that in their curriculum, if it can put the breast cancer screening at least, if not the treatment. And third thing which I would like to emphasize is that there should be some legal mechanism where a law can be formed to really make the screening compulsory.
Compulsory?
Yeah.
What, like a self-paced exam, whether you like it or not, somebody touching you, got to go and get it done.
No, by creating awareness, there should be a, they should be brought under some kind of legal mechanism that the breast cancer screening is mandatory.
But health is a choice, Dr. Bapna. How can it become a law?
Would you make a prostate cancer screening compulsory?
Is it screenable?
No. But in the breast cancer, we have clearly shown with the data that the early detection and screening definitely causes impact in the society.
But that is without any compulsion. We have shown that. I mean, let's be a little patient. I'm sure we'll get there.
Right. Otherwise, let's check with Dr. Prasad, with Urvashi Prasad, what she feels. Do you need a law? Dr. Prasad, do you think between carrot and stick, it's now time for stick to get more women screened?
Am I audible, Anisha?
Yes, we can hear you.
Okay, great. So, no, I mean, I think, firstly, if we want to make something mandatory, we need to have, in any case, we need to have the means for how do we do it, right? So we firstly are not even at that level where we have, like I said, this sort of a tiered screening system rolled out across the country. So first, we need to ensure that we have at least that kind of supply mechanisms in place, and women would not, or their families would not need to incur, a sort of additional burden, financial or otherwise, because if somebody is living in a small village or town and the nearest screening center facility is far off, and then I tell the woman, you have to do it, you have to travel at your own cost, go and get screened. So I'm just thinking from that perspective. I mean, there's no doubt that the evidence is, of course, very strong that, the more you get screened, hopefully the earlier, a disease gets picked up, not just for breast cancer, but really any of these NCDs, we usually have, better outcomes. We usually save more costs for the health system and for the families, etc. But I would just hold off on mandating it at this stage. I think we really need to first focus on universalizing access. Then we can think, what do we do more on the demand side also.
So, Urvashi ma'am, as long as we're fixing the supply side, do you think incentivizing will help? Because we've seen in the case of midday meals, kids stay in school. They're not dropping out because they get that meal. Can we incentivize women to go and get screened?
Yeah, we certainly can. Again, I would be very thoughtful in the design of how we design this incentive, how it works. We have incentivized things like institutional deliveries, right, in the past for women.
Yes.
And then we also realized that there were some unintended consequences, so we ended up having women having institutional deliveries who perhaps didn't even need one, right? Or all sorts of complications coming out of those. So there was also evidence to the contrary. So I think per se, incentivization is always a very important tool. We often use it. We often think about it in public health programs. But we would just need to be very thoughtful in how we actually design such a program, how we roll it out, and how we structure it. So I think in principle, I would agree with it. But the design is something that I would have much broader sort of stakeholder consultation involvement before we roll out something.
Yeah, so a lot of heads need to come together to work something that.
Sorry to interrupt, but while Urvashi is still there, may I ask her a question?
Yes, ma'am, please go ahead.
Urvashi ji, I feel that our health system works in too narrow a silo. Can we not have some kind of overlapping mechanism with the education department, the labor department, so many others that can sort of feed into the general health of people? I'm not talking necessarily only of women, but certainly of various people, environment, sanitation. All these are factors that feed into good health. And if we promote good health rather than just a fear of a particular disease, we might just get there a little faster.
So Jyostna ji, couldn't agree with you more. It's one of my, personally, I think having worked in this space for whatever number of years I have, one of my biggest pain points, one of the biggest things I always try to point out in whatever forum I can. Even if you look at something like nutrition, we don't even need to go as far as, as far I say, because, that's how people think of it. But actually, even water, sanitation, environment, gender, education, they're also linked. But even nutrition is part of a separate ministry, in our structure. So when we try to,
even drugs is part of a separate ministry.
That's right. So, often our work is trying to get health and, women and child to work together, which should not ideally be happening. So I think I completely agree with that. And I think that is why the push for more of a public health approach, because the moment we'll talk public health, we'll have to make it intersectoral. Public health by its very definition is intersectoral. It's not just medicine or just one field. You'll have to involve, behavior scientists. You'll have to involve all sorts of people. So I think that is why the push for, getting public health much more importance within the system. And I think if we come up with some concrete steps like this, like a public health cadre, getting in more such professionals, then I think we'll be able to, sort of raise the profile of this and get some of these very, very long-term, legacy issues. We've had these ministries run this way for decades. And we really need to change it. So could not agree with you more there. But I think hopefully if we keep advocating, keep trying to do some concrete things, and then, continue with our advocacy, we'll hopefully, get there sooner rather than later. Yeah.
Yes. Fingers crossed that this will happen very soon. Now, Karina, we've heard of stories of, women, they go on maternity leave, they miss out on promotions, their clients are gone because somebody else have taken their clients, and many aspects of professional growth gets impacted. Now, breast cancer treatment also takes time. Sometimes it's a prolonged affair during which women may be absent from work. So what do you think is the right approach that she must take from the beginning? Should she hide the disease? Should she be forthright about it? Should the management come out with a plan? What do you think?
Thank you, Anisha, for the question. It's my own personal belief that the woman should be very forthright about it. And I think to demand, specific, let's say, time off or flexibility based on the situation, because I've come to realize in my career that the men do it as well, right? So why not the woman? So sometimes I think if the woman don't be forthright or are fearful to share the circumstances that she's in, then she's actually made life even more difficult for herself because she's the first barrier. Even before, maybe her manager or her peers are very supportive, but she wouldn't even allow that to happen if she didn't share it with the others. And I understand that maybe not all situations are, or women are in such a privileged situation. Maybe they may face some difficulties in their workplace if they are to undergo cancer treatment. But I think eventually, if the support is not there, not being forthright about it at the beginning, it only kind of delays the issue. It doesn't really help solve it in the long run. So I think, maybe take a chance and be forthright. This would be my suggestion. And for example, in other sessions, I believe some of my colleagues who are breast cancer warriors have joined your sessions, and they've shared their own stories of how they fight cancer while still being an employee of our company. And those are very inspirational examples.
Right. We've heard those inspirational stories, definitely. They're very motivating for all women, whether they have the disease or not, to stand up for themselves, to love themselves, to take their health in their own hands. It is very inspiring. Dr. Bapna,
yeah,
for healthcare and for early screening, for good treatment, for good counseling, what does the healthcare system need? Will having more female practitioners help? Does that create more empathy? Do you train the other support staff, the nurses, the other staff, the counselors? How can we make this experience holistic and a less scary one for a breast cancer patient?
Yes. So it is basically a team approach. So like in our institute, ours is a very comprehensive cancer care hospital in the state. So we have a very robust outreach program where we have our own, the bus which has inbuilt the mammography machine and the sonography machine. So every week we go to the outskirts and villages of Rajasthan, and we organize camps over there with the help of NGOs. So this is definitely working us, very well for last more than 2 decades. And on the last Saturday of every month, if we advertise in the daily newspapers that on the last Saturday of every month, we organize free camp for these patients for the clinical breast examination, and we also offer them the free mammography test also. So this is really attracting the large number of the patients in my city, and also on the outskirts of our city and the various different far-flung areas of our state.
Okay, so this is a great great effort and a great undertaking on the part of your hospital to do this. Yes. And we've heard this from some of our speakers from other states as well, especially some of the South Indian states that have the Aayog healthcare scheme, where a lot of these issues are being addressed. Now, as part of our meaningful action and awareness to eradicate breast cancer from India, we feel that there is a need for a national pledge in the form of a public campaign to create awareness among the masses about breast cancer and taking appropriate and necessary actions to come out of it. Through this national pledge, we invite the government, responsible authorities, private organizations, educational institutions, and cancer survivors and influencers from various segments to come forward and show their solidarity and support the National Pledge campaign and build accessible build accessible infrastructure and information centers and create this awareness about prevention and timely treatment to eradicate breast cancer from India. We wholeheartedly welcome Novartis for supporting this massive drive and are privileged to have the support of all our panelists here. who are talking about breast cancer and creating this awareness. So I would request all of you to please visit the website of IHW Council, which is ihwcouncil.org, and please do sign this pledge. We'll all pledge our support to continue this national pledge campaign to fight breast cancer until we achieve 0 cases in India. Today, let's make that pledge to make Bharat breast cancer mukt, if not completely mukt, at least everybody should be diagnosed early so that there is cure. Because this is a disease which can be cured. Now, Dr. Rathi, we heard a lot of issues, from a policy perspective, how it should be seen as a family issue, as a public healthcare issue, and how women should not be stereotyped. Now, how do we, there are a lot of the problems some of the women have that, finances is a problem, a lot of discussion. How much of a problem is that? Do we need to discuss this also? Because, it's great to have early screening and find all the women early enough, but then the treatment, they should be able to take the treatment as well. So is this also an important part of, how we will manage this problem in the future?
Hitting the nail now, this is where you diagnose early, but how do you treat these earlies? So very, very important. Fortunately for us, I'm working in a Delhi government medical college. Our patients get most of the treatment, if not all, most. They get it free. But, मेरा जब patient का workup होता है, so the first page, I ask my residents to write the beneficiary status, the financial status, and the support system. If the patient is a beneficiary, like if you are a government employee or you are an ESI or whatever, if you have a beneficiary system or you have insurance, then that fear of finance is never there. But when it is out-of-pocket expense or whatever, then it is definitely a fear. That you have to cut it from somewhere. You never keep money for falling ill. You keep money for daughter's marriage, you keep money for building a house, for buying a car, for this. But you never save for falling ill and then investing it on yourself or herself. So this is definitely an issue, But like I said, I'm fortunate to be working in an institution where I am able to give the care free to my patients, but there are a lot of places where these patients have a lot of difficult times, borrow money, and then you take treatment, and then you are half-heartedly taking it down. If you have financial crunch, you will obviously not take it. And I told you, interrupted treatment is a bad treatment. A continuous treatment is the best treatment. So we somehow ensure, request to all the companies, the NGOs, to adopt a patient.
That's the best.
Normal people come to me, sir, we will provide 2 + 3, 1 + 2. So I tell them, no, you provide me 100%. You adopt a patient, take the treatment to the last. And that is how. You trust me that I'll give you the right patient to be adopted. And that's how it goes. It's a problem. It's a problem, definitely, Anisha.
Jyostna ma'am, what do you think should be the priority areas for leaders, either in policy making or the healthcare center, when it comes to breast cancer treatment and management? Is financing the treatment also an important issue, or diagnosis, care, advancements? What should be the focus?
Look, everything depends on finances at the end of it. I know Dr. Rathi says that, the Delhi government gives most things. What the Delhi government and whatever, Aayog Niti or whatever it's called, don't give is chemo drugs. They don't give daycare treatment. So therefore, all that burden, which is possibly the heaviest part of the expense, falls on the patient. So a little better analysis of how help should be given will make a big difference. But Anisha,
ma'am, we had some of the speakers from South India saying not only chemotherapy, but even Transmazap is given free to patients who come to them.
Yes, the southern states seem to do much better. As Indian Cancer Society, we do have cancer care fund, we have our own medical assistance schemes. But at the end of the day, there is a cap on that. We can give only up to a certain amount because we take with one hand and give with the other. If we are not given, as Dr. Rathi again said, that we will give only so much, then we are also hamstrung by those constraints. So that is necessary. But there's one point I want to bring up, Anisha, which I think the doctors will also agree with. It is not just the poor who suffer because of financial costs. The BPL get a lot of advantages which the just above BPL and the middle class do not. And I know that middle class families in particular are pauperized by the cost of treatment. And the one area which I have great difficulty with, when everything else fails and they are being given experimental drugs or prescribed experimental drugs by major hospitals, the cost of each dose being somewhere around 20 lakhs. Is it ethical to do that? You know that that person is not going to survive for more than 3 months or 4 months at the most. By telling the family that there is this little hope, you are getting them to run around in circles, whereas that is a valuable time for family bonding and for proper farewells. What is a doctor's duty? I know that doctors will say our duty is to treat. We have to find some way of curing. But you know very well that it's not going to cure.
Am I talking of clinical trials?
No, I'm not talking of clinical trials.
Clinical trials are free.
They're all
free. We don't charge.
The patients. Yeah. But there are people who prescribe these drugs.
Okay. Dr. Bapna, would you like to respond to this?
I'm not at least aware, so I really can't comment. Must be, the individual approach, not a generalized. So can't put that as a blanket statement.
Okay. So maybe
even if there are 10 doctors saying the same thing for the poor patient, it is still out of their reach.
But ma'am, something like this must only be suggested to people who the doctors feel can afford it. I mean, they would also then assess.
Yes, even if let me tell you about one case. That lady was getting reimbursement from her husband's company. The company was beginning to ask, are you justified in prescribing this? Because in the same amount, our money could treat 10 other people.
Yeah, so that's an important question and one that perhaps will be discussed and debated. We've come towards the close of the show and I'm going to take some concluding remarks from everyone. Dr. Kochhar, you go first. You have told us that, we need to put women at the center of our family, give her respect and care. And this is actually a family issue. This is not, if you're just going to think that breast cancer, the woman has it, give her medicines, give her support, and it's going to work, that's not going to work. So in your mind, what is the most important thing that we must do on a leadership level, on a societal level, that we come out on tops when it comes to fighting breast cancer?
It's about it's about creating.
Dr. Bapna, I request Dr. Kochhar to go first, and I'll come.
Okay. So what we should, one thing is we should we as leaders, we can send the female employees or those who work for us, that is one thing. For these scans and for these things as soon as they reach a certain age. And of course, also, like I said, all the people I know, tell them and teach them how to take, the self-examination and tell them like Dr. Bappa was saying, we have to tell them when to do it. That is one. And the next thing is, when they come across, when they have this cancer or if they ever have cancer, then we have to see that we give them as a company all the support, and that is what we do, because we have to give them all sorts of support, whether it is financial, whether it is their time off, whatever they want. And I think if we as people who are heading companies can do that for the women, I think that would go a long way.
Right. Dr. Bapna,
Yes.
In your concluding remarks, what do you think is the topmost priority for leaders at healthcare centers?
I think we need to, from our side, we need to very focused in the print media and in the electronic media, and repeated hammering is required.
Like what? Beti Bachao, Beti Padhao campaign?
Not Beti Bachao, not about the cancer. If detected early, it is curable.
So you're saying we need to associate an influencer, we need a countrywide campaign like the one like Beti
like
Padhao,
this
Beti
one?
Bachao.
Yeah.
Okay.
Like this one, which are just now we are having, but
And
it
who
should
does
be
the-
the end.
No, but who does the onus lie with to have this kind of campaign?
Both with the government and the NGOs.
Everyone.
Yeah, everyone. The awareness is the key.
Yeah, when you're correct.
All right. Dr. Rathi, in your concluding remarks, this is our effort. We are trying to create this awareness. These discussions will be there on the World Wide Web for people to watch whenever they want, not just in October, whenever afterwards they want to watch. To your mind, is this the most important thing when it comes to treating breast cancer, diagnosing breast cancer, managing breast cancer? From the healthcare perspective, what do you think is the most important thing?
Most important thing for me is if a woman is detected early, let this lady get a priority and she should be treated fully, because this is treatable now. So this treatable cancer has to be treated as early as possible. Not only detection, but the treatment should happen as early as possible and with all kinds of supports. Like the Indian Cancer Society, I was a resident. Again, I'll tell you a story, a short story. The Indian Cancer Society was coming up when I was a resident in All India Institute. So, this Indian Cancer Society has come a long way to the level of creating a hospital which is state of art. So we can have more organizations which can help these people. And on my level, again, in a medical college, I definitely help whosoever comes to us, but I want these earlies to be treated early. That's the bottom line for me.
Jyostna ma'am, what would you like to say in conclusion? What do you think is the most important thing for breast cancer in our country?
If I can just remind everybody that NGOs work because we want to, not because we have to. We go out of our way to create facilities, to create help which benefits others. So anyone who can help NGOs to grow and to pass on that largesse would be someone we would very much welcome. Our statement of intent says the conquest of cancer by choice, not chance.
Definitely. And ma'am, you're saying that everyone should be a little open-hearted and should loosen their purse strings to help NGOs, because you never know when the shoe is on you, when you will be in that place.
Yes, absolutely right. Yeah.
You're saying along with creating awareness, we should ask people to also be a little giving to the NGOs who are helping for cancer care treatment.
Absolutely right. And I think the one group of people we have left out are the big film stars who support tobacco, who support liquor, who support every kind of menace. I think let's start shaking their conscience also.
Very true.
Yeah.
Right. Urvashi Prasad ma'am, what would you like to say in conclusion? From a leader's perspective, what is the top priority for breast care diagnosis, treatment and management in our country?
Yeah, I would just, Anisha, and apologies, there's now a lot of background noise for me, but I would just say that we need to think of, how do we tackle something like this and integrated things piecemeal to be something in Ayushman Bharat. But until we think of it as an integrated approach, looking at all the tiers of the health system, what can we tackle from a public health approach much better? Where do we need our medical system to step in? And where do we need different stakeholders to step in? Because government obviously cannot do everything on its own. So where do we need civil society? How do we facilitate that? Where do we need our celebrities, our influencers? I think all of this can be plugged when we think of designing it, in a very integrated way. So I think we need an integrated program and an integrated policy for something like this, rather than going, more piecemeal. And hopefully we'll be able to make at least some inroads towards that.
All right. So we need to take everybody along. That is what Urvashi ma'am is saying. Karina, last word from you. You have given us an example of how when women come into leadership roles, they think so differently. That sometimes the idea is there, but it doesn't occur to people. So, in your mind, in your concluding remarks, what do you think should be a priority when it comes to breast cancer management?
Yeah, from this discussion, I would vouch for having a Women's Health Day at employers. And I think that would be a reminder for everyone that that is the day that you do something, right? Either you do a self-exam, either you book a screening, or maybe you plan for finances, in case you're ill in the future. But one day so that there is the awareness to move from awareness to action. That is the day to act. So that would be something that I would vouch for, and that's a day where all the different stakeholders think about what role they have to play in order to improve women's health.
All right. I would like to thank all of you for joining us this evening and sharing with us your thoughts and beliefs from a leadership perspective on how to bring breast cancer in focus. What are the important issues that everybody must think of in their own leadership space, in their own space, to ensure that breast cancer is something that we will conquer. We will have women detected early, and we will have treatment which is effective and leads to their cure. Thank you all for joining us and sharing with us your perspective.
Thank you very much. Thank you all. Yeah.
Thank you. And we will continue with our campaign. We will continue to talk about breast cancer all this month. We'll be back in another episode discussing an important issue with breast cancer. Do join us again. Till then, goodbye.
Thank you.